Chairwoman Fox, Ranking Member Scott, and members, thank you very much for this opportunity to testify. I understand that CDC Director Dr. Rochelle Walensky is also testifying at an oversight hearing this morning. Dr. Walensky helped lead our unprecedented whole-of-government response during this historic pandemic. We are living our lives again, and the American people are safer now because of her leadership. Under her direction, we began the critically important work of modernizing our public health infrastructure. She leaves the CDC better positioned to respond to future threats. Working alongside Dr. Walensky as a partner and friend has been an immense honor. As she prepares to leave later this month, I wish to publicly thank her for restoring, in no small measure, the health of America. Now, let me offer a few data points as we prepare to discuss the President's 2024 budget and investments. Today, under the President's watch, more Americans have access to a doctor or a hospital through their own insurance than ever before. More than 300 million. And 16 million, another all-time high, have it through the Affordable Care Act. The President's new lower-cost prescription drug law is already working. Today, insulin costs only $35 per month, and preventative vaccines like those for the flu, COVID, and shingles are free under Medicare. And soon, we will finally begin to negotiate to lower prescription drug costs. We have effectively implemented the largest adult vaccination program in U.S. history, achieving close to 700 million shots in arms to tackle COVID. And finally, HHS has successfully launched and expanded 988, the 3-digit suicide and mental health crisis lifeline. We have added text and chat capabilities, lines that are dedicated for our veterans. We have added language support options. Millions of Americans have since reached out for life-saving help using 988. Our aim is to build a healthier America by moving the nation from an illness care system to a wellness care system. An illness care system leaves our most vulnerable families behind. A wellness care system invests in providing the full spectrum of health care to all Americans. Illness care allows the price of prescription drugs to skyrocket. Wellness care would seek to negotiate for the best price for prescription drugs and treat nutritious foods as medicine. Illness care requires you to get a referral to a specialist from your own family physician in order to secure mental health support. Wellness care lets you get that support the minute you walk through the door of your family physician's office. Illness care, well, it forces hardworking Americans to deplete their life savings in their later years in order to afford the long-term care and support they need. Wellness care advances long-term care and invests in in-home care so older adults and Americans with disabilities can thrive at home in their communities. The President's FY 2024 budget builds on our successes and moves us closer to a wellness care model. The budget invests in better preparing America to tackle the next public health crisis and keeps us in a ready position to confront a COVID resurgence. On mental health and substance use, we build support for crisis care services. We invest in growing the behavioral health workforce, and we dedicate resources to combat fentanyl and opioid addiction. The President's budget strengthens Medicare for the next generation. We also take care of our family members in this budget by investing in child care and preschool programs and by strengthening Medicaid home and community-based services. Americans will appreciate that the President drives forward funding for the Cancer Moonshot and ARPA-H's investments in cutting-edge medical innovation. And his budget protects and bolsters Title X family planning programs so essential to so many of our families, and it honors our responsibilities to Indian country. Through his FY 2024 budget, President Biden once again delivers on his promise to the American people to lower health care costs for more Americans with better benefits. I am very much looking forward to working with every member in this committee, and I look forward to your questions today. Thank you.